Good day, ladies and gentlemen. This is Harry. You all know me. We're going to have a little brief J&J instrument identification seminar. I am doing the seminar with Tom, one of our new franchisees from the Rhode Island, Boston area, and we're very happy to have him here. He brings a bunch of knowledge with us. And we are going to regress to instrument identification. Primarily the instruments we sell are the J&J brand, which is a very good instrument. When you receive your instrument kit, you'll get it in a nice little fold out, very professional looking. Please keep your instruments inside the kit to keep the instrument shiny, sharp, and in a presentable state to the doctor. We'll open our case, and we see we have basic instruments that the doctor uses, that the dentist uses. These in no way represent every instrument that the doctor has in his arsenal. These are the most commonly used instruments. That being said, we will move on to identification. We're going to start with our first instrument, which is a very, very basic hygiene instrument, also used by the doctor, but primarily by the hygienist. This is a scaler. This is a hand scaler. It is an S6, S7 scaler. It is double-ended. When you order instruments, you specify DE or SE, meaning double-ended or single-ended instruments. The double-ended instruments are a tad more expensive than the single-ended instruments. Sometimes you will have a combination of tips on a double-ended instrument. Not necessarily is this tip of the instrument going to be the same as this tip of the instrument, which you can read. This is a number 6 tip and this is a number 7 tip. Very slight differences. J&J offers a nice rounded handle with easy to clean perforations, so the hygienist or the doctor can grip the instrument effectively, which grip and control of the instrument in the mouth is everything in the oral cavity. This is the same thing as a Cavitron. If you can visualize an ultrasonic scaler, not electrically powered, this is a hand scaler. The hygienist or the doctor actually manipulates the scaler. It is composed of very, very sharp blades and must be sharpened regularly to maintain the efficiency of the instrument. When you have a large buildup of calculus or tartar on the enamel surface, the tooth surface, the hygienist slips this on the tooth surface thusly. This is so sharp it sloughs off and descales the enamel and calculus after it's turned to a hard state from plaque. The sharper the instrument, the easier it is on the hygienist. Hygienists and doctors develop carpal tunnel syndrome from using hand instruments so much as a repetitive injury. A good sales point for an ultrasonic scaler is an electric scaler does all of this ultrasonically without having to pull and push. Pull and push. The Cavitron cavitates and knocks the calculus and tartar off appropriately. Tom, do you have any questions or comments about a scaler?
No, not at this point, Harry. It's a different design, tip design than I thought it would be. That it works from both, obviously, the tip,
yes, sir,
but more so from the sides.
The tip, very good point, Tom. The tip allows you to go interproximal. When you are interproximal, not only do you scale the mesial and lingual surfaces of the teeth, the tongue side and the speech side of the teeth, but you must scale between the teeth interproximally. You must scale subgingivally, which means under the gum. This allows you to do all. Again, I cannot stress maintenance and sharpness of the end of the instrument. It must be maintained for efficiency. This is one of the primary instruments in the hygienist's instrumentarium. This is numero uno for the hygienist. Okay? Now, we will move on to something that most of you guys would call tweezers. And they are tweezers. See how they're at a right angle? You can see the right angle. And we also have serrated jaws. The jaws are serrated for gripping. These are packed in every exam pack. An exam pack is when you go to the dentist and on the table, on the delivery system, he has a few instruments laid out. To wit, usually a mouth mirror, a pair of cotton pliers or college pliers, which are what these are called properly. An Explorer probe, which we shall cover later, and that's usually it. That's basic instruments for him to examine your mouth. These are used to place cotton in the mouth or the oral cavity, used to place specific burrs, used to place specific gutta perches in prepped cavities for endodontists. They are also used for instrument retrieval during the procedure if the assistant needs to retrieve a burr from storage from one of the drawers or the cabinets in the operatory for the doctor. She's not going to stick her dirty hands that have already been contaminated by that patient in that drawer and contaminate that entire setup of instruments in that drawer. She will use these cotton pliers to reach in the drawer and pull out the burr and put in the doctor's hand or either put on the tray appropriately. Keeps a lot of cross-contamination and a lot of cleaning down. Also, they use them for everything in dentistry, and I mean everything. This is a tool they cannot do without. Tom?
Again, it's a nice looking tool.
They're very precision. This is surgical steel. Okay? Now, you will also see cotton pliers or college pliers that have a latch on the side of them that lock for placement. Very handy, more expensive than the regular cotton pliers. Okay? The important thing is the integrity of the tips. There's no sharpening on these. The integrity of the tips, they must be checked regularly to make sure that they occlude or they meet good. That they meet well, no slop, make sure nobody's tried to turn a screw with them or do something improper with them. This is a very easy sell. Very, very, very easy sell.
Now, Harry, do we have access to the one that locks?
Yes, we certainly do.
So this is just a display of some of the key ones that you
Absolutely.
talked about, the
Yes,
most
sir.
important, but we have access to a wide variety.
Yes, sir. We have access to many, many more instruments than this. You can call Chris or email parts@dentalfixrx.com to receive a J&J catalog if you don't receive one at the time of training. We'll be happy to send you one. And I will be happy to go over the nomenclature with you over the phone, or we can Skype or do whatever we need to do so everybody's on the same page. Okay? Cotton pliers. Now we're going to move on to another very, very, very basic instrument for the hygienist and for the doctor. This instrument will come in an exam pack, and it will also come in the hygiene pack when she does a prophy or a tooth cleaning on you. This instrument is double-ended for obvious purposes. Two ends, correct? One end looks like a sickle with a hook. It's like a thumbtack. It's sharp, semi-sharp, but blunt. This is called an explorer. And the doctor literally explores your tooth surface with this to look for carious lesions or cavities or soft spots in the enamel. The way he does this, imagine my watch is the tooth surface. And the little pits and fissures and grooves on the top of your tooth, he punches and punches and punches and feels for soft spots or spongy spots on the enamel. There may be a cavity the x-ray didn't catch. There's nothing like a manual examination with a probe. The doctor is trained, and the hygienist is trained as well, to probe and feel for slop, sponginess. We should get a good resonation when you hit hard enamel and calcified enamel. When you hit soft enamel, this will bury.
So that's the one that when they do find a cavity, more times than not, that leaves stuck in your mouth, hanging out there going, you've got a cavity.
Yeah, to kind of drive the point home.
Right,
It's all important how deep the cavity is and how hypersensitive the patient is.
So I can imagine maintaining a tip on this is paramount.
A lot of people will sharpen them, but Tom, feel that. It's not all that sharp. It's not like sharp like a razor blade. Like I said, it's semi-sharp. A lot of people will whittle them down so much that they whittle way on down. This is one I don't recommend sharpening. This is one that uses absolute replacement. Okay. On our other end of the instrument, we have a pointed tip with gradients on it. Paul, if you could zoom in on that to see the different. If you could notice the shiny to black contrast on this tip. Each one of those black increments represents 5 millimeters. This is a perio probe. Periodontal meaning gum or gingiva. When you go to the dentist and you get a cleaning, the hygienist stands beside the dentist after your prophy or cleaning, and you'll hear him shouting out numbers while he's pushing an instrument into your gums. You'll hear him go 5 mesial, 6 lingual, 7 interproximal, number 19. The number 19 specifies the tooth number, the anatomical tooth number, the juxtaposition of the tooth in the mouth. The other numbers he's calling is how deep your periodontal pockets are. Now, if we can remember from our training, a periodontal pocket or a perio problem is gum related. This is actually sunk between your tooth and the gum in the gingival margin and pushed down until the doctor feels resistance. That way he can get an accurate measure of your perio pockets or your periodontal lesions. And usually you get exudite if you have perio problems. When he probes, a little pus, which is known as exudite, and blood comes out. Both are indicators the patient needs further treatment for soft tissue management, for gingival problems and perio problems. If this is dropped, it gets bent, they get distorted. Then again, they have to be handled with care. If a wavy perio probe is of absolutely no use to anybody, and it's very uncomfortable to the patient. The doctor might as well throw it in his drawer and punch holes in his knob to hide with it or whatever, because it's absolutely useless after it's been or dropped. Okay. Explorer probe, a primary instrument in any exam pack. Now we're going to move on to a very interesting instrument. These are called articulating paper forceps. Now, in medical and dental terminology, we can say that forceps are probably Latin for pliers because they do the same thing. Okay. This is surgical stainless spring steel. As you punch it together, as you squeeze the handle together, you open the jaws of the forceps. The inside jaws of the forceps are serrated so they can grip what they're holding. When they put a crown in you or do a filling, you remember the dentist goes tap, 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 bite, 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 tap, tap, tap. He puts a piece of carbon paper in here, which is known as articulating paper. Okay? This articulating paper is ribbon shaped and long. Is held in here, and the patient bites. The carbon on the articulating paper, the ink, will show up on the high spots of the teeth and tell the doctor where to take his handpiece and adjust the teeth, thusly adjusting your bite or setting you back into occlusion. These tend to walk off from doctor's offices a whole lot. These tend to walk off. This is another high sale item. And this is so much lower price than the nearest competitive brand, than a Miltex instrument. It is ridiculous. It is ridiculous. If you can't sell this, this is a really easy sell, gentlemen. Okay, very, very, very easy sell. Every dentist has one. Okay, or 2 or 3 of them.
And if they don't, we're here to help them out.
You can sell them. Our next instrument we're going to go to is known as a curette. This is a double-ended curette. Okay? One is a number 13, the other one is a number 14. Very subtle differences in the heft and the haft and heft of the instrument. Okay? These have semi-sharp edges like a scaler. Tom, can you feel that? although the edges don't extend all the way down the haft of the instrument.
Right.
Okay. A curette is used for bone shaping and contouring. A curette is used by a hygienist or a dentist if they're doing an SRP on you, which means scaling and root planing. If a patient hasn't had a scaling in a long time, subgingivally under the gums, you build up calculus that will eventually ossify and turn to a semi-bone state. They go subgingivally with this, or either supragingivally on top of the gingiva, and they actually carve the bone with this. The bone is actually carved and planed. The smooth bone allows the gum to grow back to the bone without any voids in it, thusly eliminating pockets of infection or perio pockets. This is to shape and contour and sculpt bone, osseous tissue. Then again, let me stress the round handle, the comfort of design, and the serrations, the perforations on the handle that actually allow the doctor with a glove on to have more tactility and a better grip. The doctor, the hygienist, and the instrument user, the operator, holds these instruments the same way he does a pencil, the same way he does an handpiece. And by the way, ladies and gentlemen, if any of your instrument tips break off from J&J, you can send them back for repair, you can even send them back for sharpening, and you can send them back for retipping. You don't have to chunk the instrument away, it can be retipped, and it's retipped with a guarantee.
Now, Harry, would your
Yes, sir.
oral surgeon, would this be a tool of theirs as well?
This would be very, very vital to an oral surgeon's instrumentarium. Very vital. Very vital. Because he may have an instance where he's done an extraction and there's still a bony socket and he wants to smooth that bone or curette that bone down so it doesn't leave a ridge in the gum after the gingiva grows back over the socket. He's actually smoothing down your jawbone and the existing what's left of the tooth socket. Next, speaking of oral surgery and extractions, this bad boy is officially listed in the Johnson & Johnson catalog as a gouge. You will hear it called an elevator or an excavator, either one. Elevate meaning to raise, excavate meaning to dig. Okay? You see how the handle is a lot bigger on this instrument? And notice how we have cutouts for the thumb and forefinger. You see that, Tom? The doctor, this is one that he does not hold like a pencil. On the tip of the instrument, we have a slight cutout. See that? See how it's concave? See the concave in the tip of the instrument? That's semi-sharp. Feel it.
I think it's a little more than semi. I think that could probably cut into something pretty well.
That's kind of semi-sharp for dental or medical.
Okay.
Not. Usually, stuff is so sharp you could blow across it and it splits the microbes. When they have a tooth that needs to be elevated, that you're extracting, you need to elevate the tooth from the socket. They go down between the gingiva and the root or the apex of the tooth. The apex of the tooth fits in your concave part of the tip of the instrument, and they actually luxate, not leverage it up. It's called luxation. They luxate very gently. Luxate, luxate, luxate. Luxate means quite literally to wiggle inside you. Okay? This elevates the tooth up. They can also turn it over to excavate dead tissue and dead gingival tissue and chipped off osseous tissue or bone from the socket. So you can excavate or elevate with it. You'll hear it called both terms. Every dentist has this. It is tough to do an extraction without it. Okay? It can also be used for root tip removal if a root tip breaks off during the extraction process, because the concave surface goes around the root. You can use it as a root tip pick as well. Our next instrument is a hinged instrument. Quite obviously, it has a hinge on it. Hinged instruments are classified slightly different. I'm sorry for moving around so much, guys. Hinged instruments are classified slightly differently than a one-piece instrument, and they take slightly different care. To wit, they should be open during sterilization. Number one, to allow the steam to go around the surfaces, the cutting surfaces of the scissor, and also to keep it from rusting shut. Even though it's stainless steel, they only take so many sterilization cycles. These instruments are only as good as you maintain them. These scissors will cut anything, from kryptonite to gum, if they're maintained right and sharp. These are used for suturing, suture removal, cutting old sutures out. If they put a crown on that the margin's a little too deep and the gold or the precious metal that the crown is constructed out of, they can actually trim the margin with this. This will actually cut metal as well. An infinite number of uses in dentistry. Infinite number of uses. They don't have serrated tips. They don't have serrated cutting edge. It's a smooth surgical cutting edge. And it is sharp. And it's pointed as well. It's pointed so they can go up under suture loops, open the jaws, and snip, and then remove the sutures with the cutting edge. Now, forceps again. Remember our articulating paper forceps? We stated that they are nothing but medical pliers. These are extraction forceps. And these are for anterior. These are for your anterior teeth, which are your front teeth. On the inside jaws, you can see we're concave, just as in the excavator or elevator was. Can you see the concave surfaces, Paul? Okay. These concave surfaces actually allow you, after you've elevated and excavated, to grip the crown of the tooth effectively. The doctor grips the crown of the tooth. He does what? He luxates, pop, extracts. Now, let me give you a hint, guys. When you see one blade, when you see two blades, but only one set of jaws, that's for a single rooted tooth, which is going to be an anterior tooth. The further back posterior you go, or to the back of the mouth, teeth develop multiple roots. 2 roots and up to 3 roots on your third molars. For more posterior forceps, you are actually going to see 1 piece on this side and 2 pieces on the other side, because your posterior teeth, the crowns, or the part that's above the gum, is a lot larger than an anterior tooth. Your molars, by nature, are a lot larger. So you have 3 gripping surfaces for the molars. J&J makes, I'd say, 15 to 20 different variances on extraction forceps. And again, this is a hinged instrument. You need to keep it open. You need to keep it surgically lubed. There's no sharpening to this. The bigger instruments, to wit, your forceps and your elevators, the doctor usually buys one time and never purchases again. They last forever. They last forever. They may stain, they may pit, but they're still quite useful. We have a bigger set of scissors, ladies and gentlemen, with serrated jaws, with serrated blades. The blades have slight serrations on them. Can you see them, Tom?
Sure can.
Very, very slight nuance of serrations. It's also curved. This is another type of suture scissor. Another type of suture scissor, only bigger. They also use this for alveolectomies and for frenectomies, which are trimming gingival tissue, gums, because they're so sharp. As you'll notice, they're still pointed, ladies and gentlemen, so you can slip up under the loop of a suture and cut the loop of a suture and manipulate it. Oral size dictates the size of the patient's mouth and the procedure. You see how one is straight and one is curved. One's smaller and one's larger. Same variances, different variances on the same instrument. Okay? Our next instrument is the cleoid discoid carver. Okay? And carver is just what the name implies. It carves. After the doctor has placed a composite or an amalgam in your mouth, before the amalgam or the composite is set up, he's got to carve that so it fits in with the anatomy on the top of your teeth. This instrument allows him to pack and carve at the same time. Let's do a close-up of the tips on this, guys. See how our tip is set off at a 45-degree angle? See the shape of the tooth, of the tip? It's shaped like a, let's say, an ace of spades. Okay?
Mm-hmm.
For obvious reasons, that tip and that shape allows the doctor to go down, into the occlusion and the pits and fissures and the anatomy of the top of the teeth. Just by manipulating back and forth, punching, manipulating back and forth. Let's just say we can make an analogy that it's like a miniature trowel. Okay? Same variance on the different end, only we have more of a rounded end, and we're still set off at 45 degrees. That rounded end is actually to push the material toward the sides of the tooth prep surface and actually put in place. Since this is stainless steel, nothing will stick to this. This might as well be coated with Teflon. Every doctor has this, and by the way, every lab man has this. The lab man uses this to carve wax. The wax mock-up of a tooth when they use the lost wax casting method. So lab men have this too. Lab men use a lot of these same instruments, guys. Lab men use articulating paper forceps. They use crowning collar, suture scissors. So a lot of this stuff is pertinent to labs as well. Okay? Very important. This can carve amalgam, wax, or composite. It's not for enamel, but it's for enamel replacements. Okay? Next, we have an old standby known as the hemostat. Hemostats are hinged instruments, and they're just what the name implies. Hemo meaning blood, stat meaning stop now. A hemostat literally is used to clip off a blood vessel or a blood vein or a capillary, just like you would pinch off a piece of tubing with water coming through it. Hemostats uses are so varied and they have so many applications in general orthodontic, periodontists, oral surgery, and prosthodontists. This is an invaluable instrument. This is also a highly lost instrument in the doctor's instrumentarium. Okay? If you notice, the jaws are serrated. Hemostats are used for instrument retrieval and placement, like that. Used for gutta-percha placement in endodontically prepared teeth. Used to stop blood. They use it to clamp towels around the patients. The uses are myriad. They also use it to hold suture needles when they sew. When they're suturing up a flap or a piece of gingiva. They punch the needle through with it and pull. There's a product made very similar to these called needle holders that have a cutout spot exactly for the needle. No need in the needle holders when you've got hemostats. They are absolutely used for everything and are invaluable. Hinged instrument as well, care must be taken. No sharpening other than just regular maintenance. We're going to discuss regular maintenance, which is very simple, in a few moments. The hemostats lock with a series of ratcheting ends, like this, holding them in place at different torques. Just for whatever knots you're going to use. You will see so many hemostats in doctors' offices, but you'll see so many tore up ones where they've screwed screws with them and used them as pliers and everything else.